Hand hygiene. On completion of this module, you will know why hand hygiene is essential, when to perform hand hygiene, the different ways to perform hand hygiene, how to wash your hands correctly, how to use alcohol hand gel products appropriately, and your responsibility in maintaining good personal hand hygiene. Microbiology and infection control experts agree that the single most important step to prevent and control the spread of infection is hand hygiene. When working in any healthcare setting, it is essential that our hand hygiene technique is excellent at all times. Hand hygiene is the process of cleaning your hands by following a series of simple steps. Let's take a look to see what parts of the hands are often missed during the cleaning process. On the screen now, you can see the parts of the hands most often missed, in red. The parts of the hands that are less often missed can be seen now in blue. The least often missed is coloured white and is highlighted now. The picture shows that although you might spend time cleaning your hands, you may in fact be missing important parts of your hands as you clean them. The reason you clean your hands is to rid them of microorganisms or germs that can cause the spread of infection. Let's take a look at what might be on your hands. When you look at your hands, they can be visibly dirty, and you know you have to wash them. But often your hands can be physically clean, look fine, and you may think there is no need to clean them. Although your hands may look clean, they may have microorganisms or germs on them that you cannot see. This means they are not actually hygienically clean. There are two types of microorganisms that can be found on your hands. The first can be found on the skin surface and can survive for only a short amount of time. These are called transient flora. These microorganisms can be very easily passed from one person to another, unless they are removed, and are the microorganisms that are commonly associated with healthcare-associated infections. The second type of microorganism that can live on the skin are called resident flora. These microorganisms can live much deeper in the skin. Resident flora are not usually associated with healthcare-associated infections. However, they can cause infections in patients who are very vulnerable to infection. When working in the community, your main concern is transient microorganisms that you may pick up on your hands as you go about your daily work. Remember, these are not visible to the naked eye, but can be easily removed by carrying out the correct level of hand hygiene. You should clean your hands before and after every physical contact with a client, and after every time you have completed a task. Some obvious examples include if your hands look dirty or feel sticky, after taking a client's blood pressure, dressing wounds, or tending catheters, having handled bedpans, commodes, incontinence wear, before putting on and after taking off gloves or aprons, after using the toilet, blowing your nose, covering a sneeze or smoking, having changed a child's nappy, before and after eating or preparing food, having handled raw meat. Some not-so-obvious examples include having assisted a client to move from one room or ward to another, before starting work or when you have finished work. As a general rule, clean your hands if you are in any doubt whether it is a good time to do so or not. Try to think, what have I just done and what am I going to do next? Just think of all the items you have touched, for example, door handles and telephones, or the tasks you have performed. If it is likely that you may have picked up microorganisms on your hands, then you should perform hand hygiene. By cleaning your hands, you will greatly reduce the risk of spreading microorganisms and causing an infection in a client. The Guidelines for Hand Hygiene in Irish Healthcare Settings, published in 2005, set out 3 different levels of hand hygiene. These are social, antiseptic, and surgical hand hygiene. Social hand hygiene is used to remove dirt and organic material, dead skin, and most transient microorganisms from your hands. It can be used following most daily tasks and involves washing your hands with a liquid soap and warm water. Or, if your hands are visibly clean, you may also use an alcohol hand gel or rub. Antiseptic hand hygiene is used where a higher level of cleanliness than social hand hygiene is required. For example, if a client is immunocompromised. When carried out correctly, it will remove most transient microorganisms. It involves cleaning your hands with an alcohol hand gel or rub. This technique should only be used where your hands are visibly clean. You can also wash your hands with an antiseptic liquid soap to achieve antiseptic hand hygiene. Surgical hand hygiene is used before all surgical procedures and removes all transient and resident microorganisms. This level of hand hygiene is rarely required within community settings. This DVD focuses on two aspects of hand hygiene: washing your hands with a liquid soap and warm water, and cleaning your hands using an alcohol gel or hand rub. When performing hand hygiene, it is useful to think of this formula. 1. You will need the right amount of appropriate product. 2. You will need to follow the correct technique that cleans all areas of your hands, paying particular attention to the areas most frequently missed, such as your fingertips, thumbs, and wrists. 3. You need to spend the correct amount of time at the technique. And 4. You will need to make sure your hands are dried in the proper way. In preparation for carrying out hand hygiene, it is important to remember some general pointers. That nails should be kept short, and nail varnish, false nails, and hand or wrist jewellery should never be worn while you are working. A ring, such as a plain band without stones or ridges, is all that is permitted to be worn while on duty. It is important that you always remember to rotate the plain band when cleaning your hands, to make sure you also clean the skin underneath the band. Also, before starting work each day, you should cover any cuts or abrasions on your skin with an impermeable plaster. Now let's look at the correct hand-washing procedure. Social hand hygiene through hand washing with liquid soap is used to remove dirt, dead skin and most transient microorganisms from your hands. Using the formula from earlier. 1. You will use a good neutral liquid soap and warm water. 2. The technique will involve a number of steps that covers the back and front of each hand, the fingers and the wrists. 3. You must spend a minimum of 15 to 20 seconds washing your hands. And finally, 4. You should pat your hands and wrists thoroughly dry, using good quality disposable paper towels. To recap, you should always wash your hands when they are dirty or sticky. You should also use hand washing before and after each contact with a client, at the beginning and end of the work shift, before putting on or after taking off gloves or aprons, after handling dirty equipment or materials, before preparing or handling food, after blowing your nose, smoking, or using the toilet. This list is not exhaustive. Let's take a look at how to wash your hands step by step. Following the correct hand-washing technique ensures that all areas of the hands and wrists are cleaned. You should use a good neutral liquid soap. Make sure that the water is at the correct temperature and then follow the steps as shown in this video. First, wet your hands thoroughly using running water. Cupping your hands, apply 5 milliliters of soap by pressing the soap dispenser with the heel of your hand. Try to avoid using your fingertips on the dispenser. Rub the palms of your hands 5 times to create a lather. Rub your right hand over the back of your left hand 5 times up to wrist level, and then do the same with the other hand. Rub your right hand over the back of your left hand 5 times while interlacing your fingers. Then change hands and repeat the process. Rub palm to palm 5 times, this time with your fingers interlaced. Rub the backs of your fingers to the opposing palms with your fingers interlocked. This ensures thorough cleaning of the fingertips. Ensure that soap covers all parts of the thumb using a rotating motion. Rub the tips of your fingers against the opposite palm using a circular motion. Then change hands and repeat the process. Place one hand on your wrist and rotate around your wrist 5 times. Then do the same with your other wrist. Rinse your hands and wrists thoroughly under running water to remove all traces of soap. Turn off the taps using your elbow, making sure not to touch the taps with your clean hands. Dry your hands completely using a disposable paper towel. When drying your hands, start from the fingertips and move towards the wrist. Put the paper towel in the correct waste bin using the foot pedal to open it, to avoid inadvertently contaminating your hands from the lid of the bin. This hand washing technique takes a minimum of 15 seconds, with additional time required for drying. This is the same technique you would use for carrying out antiseptic hand washing using a liquid antiseptic soap. Using alcohol gel or rub to clean your hands is similar to the technique used for hand washing. You must always remember that alcohol hand gel or rub can only be used when your hands are visibly clean. If you think about our formula from earlier. 1. This time you will use an alcohol hand gel or rub. 2. The technique involves a number of steps that covers the back and front of each hand, the fingers, thumbs, and the wrists. 3. You should spend a minimum of 15 seconds cleaning your hands. 4. Your hands will dry by themselves. There is no need to use paper towels. Drying will take about 30 seconds. There is no need to use water in conjunction with an alcohol hand gel or rub. This is a water-free method of cleaning your hands. If your hands are visibly clean, alcohol hand gel or rub can be used in many of the same situations as hand washing. For example, before and after each contact with a client, at the beginning and end of the work shift, before putting on or after taking off aprons, before preparing or handling food. Alcohol hand gel or rub should be used in the following situations as an addition to hand washing with a liquid soap to achieve antiseptic hand hygiene. Before and after any contact with a client who is known to have an infection or who has a wound. Before doing any invasive procedure on a client, for example, putting in a urinary catheter. Before and after each client contact in critical care areas, and with those who are immunocompromised. Let's take a look at the technique in action. Cleaning your hands using alcohol hand gel or rub takes a minimum of 15 seconds. You should follow the steps outlined in this video. Cupping your hands, apply 5 millimeters of alcohol hand gel or rub by pressing the dispenser with the heel of your hand. Try and avoid using your fingertips on the dispenser. Rub palm to palm 5 times. Rub your right hand over the back of your left hand 5 times up to the wrist level. And then do the same with the other hand. Rub your right hand over the back of your left hand 5 times while interlacing your fingers. Then change hands and repeat the process. Rub palm to palm 5 times with your fingers interlaced. To clean fingertips, rub the backs of your fingers to the opposing palms with your fingers interlocked. Rub the thumbs of each hand separately using a rotating motion. Rub the tips of your fingers against the opposite palm using a circular motion. Place one hand on your wrist and rotate around your wrist 5 times. Then do the same with your other wrist. Your hands should dry by evaporation. This should take about 30 seconds. When carrying out hand hygiene, it is important to remember that it is not appropriate to use alcohol, hand gels or rubs when dealing with a client whom you know has a Clostridium difficile infection. The spores which the Clostridium difficile bacteria can form are resistant to alcohol. Therefore, it is very important that you only use a liquid soap to carry out hand hygiene in these circumstances. As a community healthcare worker, you may be faced with a number of different situations when it comes to cleaning your hands. If you are working in a client's home, there may be no soap, towels, or suitable cleaning facilities. It is important in circumstances like these that you carry liquid soap, paper towels, or alcohol hand gel or rub. You should talk to your manager if you require access to any of these items or for more information. You may be faced with situations where hands-free taps, as shown in the video demonstration, are not available. In this situation, it is important to remember that when you have finished washing your hands, you must turn the taps off using the paper towel that you have just dried your hands with. You can see this in the video on screen now. This will prevent microorganisms from getting onto your hands again. If there is no paper towel dispenser, have paper towels, like kitchen towels, laid out close by for easy access, but make sure that they are not too close that they get wet. It is also important to make sure that the paper towels are thrown into a bin which you can access easily. It is important that you do not touch the bin when placing items into it, as this may contaminate your hands again. So, to recap. You may wonder when is the best time to wash your hands using liquid soap and water, or when to clean them using alcohol, hand gel or rub. Here is a quick rule of thumb to help you remember. If your hands are visibly dirty, you should always wash them using a good liquid soap and warm water. When your hands look clean, in most situations you have two options. 1. You can wash them using a neutral liquid soap and warm water, or 2. You can clean them using an alcohol hand gel or rub. If using alcohol hand gel or rub with added emollient regularly, it is advisable to wash your hands as per manufacturer's instructions, as an excessive build-up of emollient on the hands may occur. Each alcohol hand gel or rub may have a differing frequency of hand washing. Therefore, it is important to follow specific manufacturer's advice. Everybody has a role to play in making sure that they perform hand hygiene. It takes commitment from everyone. When work is very busy, it can be difficult to perform hand hygiene and to spend the correct time at it. Hand hygiene is essential in providing quality care to clients and can save lives. Always remember, hand hygiene can prevent the spread of infection. It should be performed before and after every physical contact with a client, and before and after completing every task. If your hands are dirty, you must wash them with neutral liquid soap and warm water. But in most situations, you can use alcohol hand gel or rub to clean your hands. If you have an existing skin problem, or if a problem develops, contact your occupational health department or your GP for advice and guidance. If you have any queries relating to the facilities or training for infection control in your work environment, you should raise the concern with your manager.